Welcome to this edition of Compassionate Conversations. My name is Lynn Flanagan and I'm the CEO at Hospice of Rockingham County. Compassionate Conversations is one more way that our organization strives to connect with, care for, and support the community that we serve. Joining me today is Jeanne Slayton. She is our Hospice Care Consultant. Thanks for being here.
Thanks for having me.
So we've got a lot to unpack. Number one, we're going to start with your title that I just said, Hospice Care Consultant. But before we dive in, what would you like our listeners to know about you?
Well, I've been in healthcare since '95, in a variety of roles, but quickly learned that dementia care and geriatrics was my favorite place. They just hold a special place in my heart. Having done everything from cardiology to family practice and everything in between. So 4 years ago almost, next month, I found my way to Hospice of Rockingham County and I've loved it ever since. This role gives me the opportunity to meet with so many different people and provide support for everyone in our community at so many different levels. It just makes my heart sing.
Fantastic. Time flies when you're having fun.
Right?
4 years.
I just realized that
awesome.
today. Oh my goodness, 4 years.
4 years. Well, so I have to say, Hospice Care Consultant, it sounds a little unusual. So I'm going to back up for myself. 4 years ago, things were a little different around here. We were not as large of an organization as we are now. We only had one service line at the time, which of course was hospice. And the thought of sales, so that's what Hospice Care Consultant is, right?
Yes.
But the thought of that at the time felt a little icky for a nonprofit hospice. Now, you have helped me learn a tremendous amount, but let's talk about that just for a little bit. What is sales? How does that relate to what we do?
Sales is technically what I do. And yes, I sell our hospice services and our serious illness care services. But a lot of that is just education. Much like selling a product, we are selling services for our community from the very best there is in Rockingham County. So I tell people, yes, my fancy title is Hospice Care Consultant.
Right.
That means sales, but what that really means is education, support, and resources for our community.
And so the resources, that connection. So there are people in our community that need these services that we offer, and you are kind of the caveat there. You're connecting, right? So you do that in lots of ways, but so let's talk about first when you go into physician offices. So it's not just education for the general public, it's education for physicians, right?
Correct.
And their providers in their office.
Absolutely.
So when you go in, what value, what are we bringing? How are you communicating this?
It depends, honestly, on who I'm talking to and what their struggle is or what they're looking for or what they need. And sometimes that shifts. COVID brought about some changes,
Sure.
obviously. So priorities shifted and looking for resources shifted. But generally, it is helping the providers and staff know that hospice is not a bad word.
Right.
That hospice is longer than 2 weeks. That, Medicare covers 6 months or more. This is what qualifies a patient for hospice. The magic question of, depending on the time of year, right now I ask providers and other staff in offices, would you be surprised if your patient was still here in the new year? And when they say, yeah, actually I would,
Yeah.
Can we talk about how to get them access to some resources so that they can be as independent and as cared for and where they want to be and all of those things? I think it amazes some folks when they really understand how early hospice can come in.
Right.
What really makes you qualified for hospice. It's not just cancer. You know, it's not the old belief that if you had cancer or you were actively dying, you could then get hospice. You know, lots more folks are actually eligible for hospice. And now that we have the serious illness care program, we can be a resource for anyone who has any chronic long-term illness. And I think that educating our providers that the serious illness care program is out there to help support and work with them, not take over, is really helping.
So that word support is so important. You know, our interdisciplinary team here, when we talk about how can we support the patient, but you just connected a lot of dots. So we can actually support the provider, the medical provider in the community. So what I just heard you say is that you're going to go in and you can help them understand how we can customize our services to not only help their patient, but to support what goes on in their office as well.
Absolutely.
So asking that simple question, would you be surprised if, can really open the door for lots of things. Because what comes to my mind is, how can we help you with that patient that has a need, calls your office several times a week?
Correct. Or is in the hospital.
Right.
Back and forth and back and forth. They don't even make it maybe to the follow-up appointment after they've been discharged because they're back in the hospital. Those are patients that could really use our support in their homes, not to mention their families.
Right. So obviously that would be kind of diagnosis dependent as to or what the individual needs are. But let's say I am a provider and hey, I've got somebody going in and out of the hospital. They've been in the hospital 3 times in the last 6 months, something similar to what you just described. They call all the time, back and forth to the emergency room. What would you say to me as to how Hospice of Rockingham County might step in and provide some support?
Again, it's very disease specific as well. So, you know, I just let our providers know that the hospice services can come in with our interdisciplinary team. So our nurses can come and visit them in their homes, obviously, wherever home is, manage symptoms, help educate. A lot of what our nurses do is education for not just the patient, but the family or the caregivers for that patient too. How to help make sure that that patient is taking their medications, or when this is a side effect, what can we do instead? All of those pieces. How to work with then the DME or the, you know, how do we get our loved one from bed to a wheelchair to the recliner without a fall? How do we manage these things safely? So a lot of what our nurses do is education, along with the symptom management and all of those kinds of things as well. But then having our social workers be able to connect other community resources for them as well. Of course, our chaplains with their wonderful spiritual support. All of that can help provide some stabilization for that patient in their home, wherever home is again, you know. And if we're working with folks who are in a skilled nursing center or in an assisted living, we also do those same things with the staff. So we can help staff help that patient or their resident the best way so that they can stay in their home-like environment as well.
So all of this support ideally makes it easier for everybody to provide the best care for this patient.
Absolutely.
And everything being very patient-centered, again, depending on what their individual needs are, what are the needs of the family. So the burden is on our staff to figure out, what do we need to do? How can we support this patient, this family, for what is, get them where they want to be, right? What's important to them in their life at this time. So if I were a physician that I have this patient that's calling a lot, But now they can call hospice. I've kind of got
Correct.
somebody in between,
You do.
but who is also coordinating care with me.
Absolutely.
Right.
And we'll handle the calls at 2 o'clock in the morning.
Right.
So the 6 a.m. calls, all of those good things provide a little bit more support to the family, obviously, but then also reduce the number of calls that your office is having to handle to increase the time with another patient that you need to help, kind of a thing. And then we'll continue to communicate and we'll let you know what's going on. And of course, if you're the attending provider, we're going to call you, update you, ask for orders, give you changes,
Right.
all of those kinds of things. So our community physicians who are heavily invested in their patients, rightfully so, who want to stay involved, still have that opportunity.
Right. So during this podcast, a lot of times we talk about misconceptions. And this is one that is out there on the provider side of things that kind of drives me crazy. I'll just tell you, it's one
Absolutely.
of my pet peeves is to hear a medical provider say, well, it's not time. I don't want them to give up. Clearly helping what I've just heard you describe, this is not a physician giving up or a nurse practitioner or medical provider giving up on their patient. This is actually a way that our organization can assist that provider in providing the best care all the way through.
Absolutely. And one of the things that I wish we did better in med school and all of those things is reframe that thought.
Right.
Teach our physicians, instead of saying when they're doing a hospice, there's nothing more I can do for you. Oh, but there is. There absolutely is. Your disease is incurable. There are no treatments that can cure or reverse your disease, whatever that is. But I have so many things that I can still offer to support you. It's just so much better.
Yeah.
It's so much more comfortable. If we can get our providers to think of it that way, one, it might feel better for them as well, so they might do it earlier.
Right.
But two, then they're still able to care for that patient. They don't have to feel like they're giving up hope or encouraging the patient to give up hope, which is
Right.
not what hospice is about anyways.
Right.
You know, there have been several studies that have shown that having hospice services earlier in the course of your disease actually gives you longer life. And it isn't not good longer life, right?
Right.
It is quality at the end of life. And because our nurses are so fantastic and our support staff is so fantastic, you know, we have patients, you know, we get travel contracts and they get to go to the beach. That's what I want to do. You know,
Absolutely.
go to the mountains,
Yeah.
go see this person's wedding or attend this family reunion or whatever that looks like, because we are involved and we are helping. You know, I wish, as the United States, we encourage women to develop birthing plans, right? We have these great conversations about how fantastic it is to bring a life into this world, and women should be able to choose what they want and who they want with them and what
Right.
music they want and what treatments they want and how that looks for them. If we could reimagine end-of-life care and model it after the way that we allow women to choose how they deliver children, that would just be so fantastic.
It would be. And so, in short, everything you've just described is there is hope in hospice.
Absolutely.
So it's hope that the patient's wishes will be carried out. It's hope that quality of life will improve. And like you said, the studies that are proving that people live longer with hospice than
Yes.
those patients who don't have hospice. And there's so many reasons that we could unpack because of that. But here in our area, so rural, right? We both know that there are so many medical providers in our service area that have cared for these people for decades,
Absolutely.
which is awesome.
Yes.
But that continuity of care does not have to end
Nope.
because someone is eligible for hospice. So if we help support them all the way through, we've actually had instances where then our support staff supports that physician's office on the back end.
Absolutely.
Because we certainly recognize it's difficult for them to lose these people too.
Absolutely.
Right? Might not be blood family, but it's still family.
It's still family.
And somebody that you have cared for years. So that's another benefit I see with medical practices here. So let's switch gears just a little bit and talk about hospitals. And as we talk about information that you take to hospitals, I think it will lead us more into the serious illness care program as well, as to how that can be beneficial. So I would imagine a lot of your role is similar, going from a medical practice into the hospitals, but how are we value add for our community hospitals?
So for our community hospitals, actually, both of our service lines are extremely helpful, but it is our serious illness care program. So hospitals are kind of the opposite of hospice in terms of their model of care and delivery and payment and all of that. They need to get people, when people come in, they need to get them seen, treated, and out the door. Medicare says you have X number of hours, X number of days based on this diagnosis to get this patient out.
Right.
Oh, and you better do a good job, because if they come back within 30 days, we're not paying you.
We're gonna ding you.
Yeah. And then we're going to keep track of how many of those you have, and we're going to reduce your reimbursement rate for the next fiscal year as well, all of those pieces. Well, that's kind of the exact opposite of hospice, right? We want to take care of patients as long as we can, as long as they remain eligible, all of those kinds of things. Well, if we can get folks on service after whether that's with the serious illness care program or the hospice, depending on their eligibility, after their first hospital visit, or if we can't get there first, their second, to prevent that third, fourth, fifth, and however many ongoing, if we can. Granted, we will never eliminate a patient's choice. Patients will always have the choice, no matter what service line they're on with us, to go to the hospital if they want to go to the hospital.
Right.
Okay. But if they have our support services in the home, and we are helping them manage symptoms, answer questions, deal with making sure they get their medication and they know how to take their medication. Because a large number of rehospitalizations are due to medication management issues.
Right.
If they didn't pick it up, if they aren't taking it once a day instead of 3 times a day, if they aren't doing their nebulizer treatments for CHF, all of those kinds of things. And a lot of times it's just because there's a lot of information thrown at you.
Sure.
When you go to get discharged, you get a packet of paper and you get spoken to, and about half of that probably goes in. So when you get home, there's a lot to manage. If our serious illness care nurse practitioners can come in and help do the symptom management, the disease education, the talking about why you need to do your nebulizers 3 or 4 times a day, all of those kinds of things, then we can hopefully prevent that second hospitalization or that rehospitalization.
So, education, communication. One of the things I think that is so helpful, we know that, and especially from COVID on, we've got a provider shortage, right? We've got a shortage of physicians, nurses, nurse practitioners. Everybody is feeling that. Hospitals are feeling it, certainly. And you describe the rapid in and out of the hospital. So there's not a lot of time for conversations, what we call a goals of care conversation, or it might be called advanced care planning conversations, but it's really, let's sit down and individualize this. Let's talk to this patient. How do you want this to go? That is where I see our serious illness program right in the beginning. Because we've got to find out all of that information.
Absolutely.
Before we can decide, now how are we going to support you to have it go just like that?
Correct.
But that is a huge component, I think, of keeping people out of the hospital.
Absolutely. And especially, so I was doing some research for another thing that I do out in the community, And here in Rockingham County, I don't know if you know, but the way our provider to patient ratio is, it is one provider for nearly 3,000 patients.
Wow.
Are residents of this county. That's
huge.
That's huge. Right. We know that conversation about advanced care planning, how do you want? Who do you want? What does this look like? All of those things takes time. It takes trust. It takes having that hard conversation. And for a lot of folks, that's very difficult. Even for our medical providers, that's a very difficult thing to have that conversation about. And honestly, when you have one doctor or one provider that could have 3,000 patients, the time constraint is a significant barrier to having that conversation.
Yep. So one of the many ways that we can truly support this community is, number one, giving somebody the space to even have those conversations. We need to be called in as early as possible.
At time of diagnosis.
At time of diagnosis. I agree. So think how many, if that happened as early as we would like to see it happen, then that patient, first of all, has got some time to think about this. Because let's be honest, there's some people that I'm sure have never even needed to think about it until they got whatever diagnosis is that they received, right? So if we catch that early, they've got time to build that relationship. You know, you've got the trust and rapport with our staff, walking you step by step on this journey, but we're also helping your medical provider understand what's important to you, how you want this to go.
Correct.
It's just win-win all the way.
And sometimes we can help be an advocate for a patient
Sure.
with that medical provider. Sometimes we need to help be an advocate with their family. I mean, that's a hard conversation. No matter what the diagnosis is, no matter what the stage is, no matter what the time of life is, no matter what, that's a very, very
Sure.
difficult conversation. Having done that and been there with now 3 family members, it is hard. So sometimes it helps having somebody else in your corner too.
Sure.
And after our serious illness care nurse practitioner comes in and we start having that conversation and whatever, you know, as a patient, it is perfectly okay to say to our nurse practitioner, hey, I want it to just be us to start with. But after we've done this, can I bring in my daughter or my son or my whomever it is that's important to me, and can you help me have this conversation with them?
So another layer of support.
Absolutely.
Yep.
It's like an onion, but in a good way.
In a good way. And we know from the work that we do that when those conversations have taken place after a family loses their loved one, they have, at most of the time, as easy as it can be during that bereavement period, it is easier if they can say, you know what, we did this exactly like Mom wanted it to go.
Yes.
They don't second guess themselves. They've heard it right from the patient. It's like, hey, and we all work together to support the family who is supporting the patient and have things go just like they want it to.
Yeah, it eliminates, you know, there's if you're close to your mom, close to my mom, I mean, she was my person. When you have to make decisions based on what you think, and maybe other family members don't always agree, there can be a lot of strife and discontent and then guilt and then questioning and all of that kind of stuff. If we can eliminate that from the start, there's just more peace. There's the ability to be present with your loved one and just be present. Not have to worry about anything other than saying what needs to be said, enjoying that last walk on the beach, enjoying that last book reading, whatever it is, just being able to be present.
Right. And then you don't feel like during that time that you were having to waste valuable time then trying to have the conversations. Let's not let it get to the point where it's crisis care versus quality and comfort care.
Correct.
Right. So, well, you mentioned, switching gears just a little bit, you mentioned a couple of other ways that you represent this organization out in the community. So I wanted to give you an opportunity to talk about those things.
Yes. So I am happy to speak with any community groups, civic organizations, churches, anything about end of life and education surrounding that hospice is not scary or icky or mean death. All of those myths that we hear and we talk about frequently. Right. Advanced care planning. We have the 5 wishes document. I can help educate about that and all of that. I mean, all sorts of different things. I love doing stuff like that. Ooh, excuse me. There are also 2 groups that I am part of. One of them is SPARK, or Service Providers and Resources of Rockingham County and the surrounding area. We kind of shortened it as much as we possibly could. It is the old, for those folks who may have been attending, it's the old Service Providers group that used to meet at the old Avante, now Cypress Valley.
Right.
We actually, well, in August, we're having Spark at the Park. So anyone who's a service provider or...
the name is fantastic.
Isn't it? I love it. A service provider or connected to serving folks in our community of any age is welcome to come and be a part of this group. Our August event is next Wednesday. I think that's the 9th, right?
It would be.
At noon at Wentworth Town Park, and we're having hot dogs and, depending on the temperature, if we can keep it cold, ice cream or some other sweet dessert. Haven't quite worked out those logistics yet, but usually our monthly meetings are actually held here in our conference room, and we have speakers, and it's all about networking, connecting folks who provide services to people in our community with each other. So finding out what resources are out there. If you need a ramp built, I know I can send you to, or you have food insecurity, I know that we have these resources in the county. Okay. You are raising your grandchildren, you need some support with that, we have these resources in the county as well. So that's a group of folks who provide those resources coming together and learning about things and how to help support our community. And then the other one is relatively new, and most folks haven't heard of it yet, but it is called Livable Rockingham. Okay. And the tagline is good for people, good for business. And essentially, earlier this year, Governor Cooper did a statewide Livable North Carolina. And it's a joint venture between AARP, and I'm probably not going to get this right, so for those of you who are listening on Livable Rock, please excuse me. But it is essentially designed to support people in their community of all ages and all stages. So what's good for the mom with a stroller and a baby, i.e. sidewalks, bump out curbs, all of those kinds of things, is also good for the 72-year-old that's using a walker but still wants to go shop those downtown shops.
Gotcha.
Right? Working with our business owners to make their businesses age-friendly. That's one of the projects that we're going to take on in several of our areas. Increasing volunteer opportunities across the board. Engaging seniors in civic organizations or volunteer opportunities or their community, we know is good for seniors, but it's also good for the stay-at-home mom who needs a break, all of those things. So there's several things happening on that end, and you'll hear more as we go along and get plans together. Right now we are submitting our application to become the 10th or 11th, and I'm not sure, one county may have beaten us out, county in the state to earn the livable designation.
That would be awesome. So it's interesting how all of those 2 other groups ties in exactly with what you do here as our hospice care consultant. So
Absolutely.
if, as we wrap up, I'm thinking about how many resources you connect people with, whether it's patients, families, medical providers, hospitals, everything you just mentioned with Livable Rockingham, but what would be one thing that you would want to share with our community about our organization here, and what a resource it could be for them?
Call us. One of the things that we know is the majority of people say that they wish they knew about hospice earlier. And I want to empower anyone, anywhere, with any sort of need. Call. If you aren't eligible for hospice services, hey, that's awesome. But I promise you, you're eligible for the Serious Illness Care Program.
Right.
And with that program, you still get the wonderful services of our nurse practitioner. We also have the interdisciplinary team that's attached to that program as well. We have the on-call services. I mean, all of those things to help support you. And again, the social workers and the resources and the knowledge to help you do what you want to do.
And really, to help you live
Your very best
life at
as-
whatever stage
at whatever
you're in.
stage, at whatever level of independence you want, with all of the community resources that we have in this county that people may not know about, because our county is large and it's rural.
Sure.
So what's on one side of the county, this side of the county may not know about, but it exists and it's available to everyone. The best way to get hooked up with community resources is to call Hospice of Rockingham County and ask for Jeanne, and I will help you. And we'll get you hooked up into whatever program you need, whatever you're eligible for. But then I'm also always happy to share community resources with folks, just to help them have everything they need to be as healthy as possible.
I think that's awesome, and I appreciate you being here today. So, listening to Jeanne and everything that she has shared with us about her role here and with other groups in the county, it really is coming back to our mission here at Hospice of Rockingham County, which is to be a supportive presence for life's journey. Thanks so much for joining us for this edition of Compassionate Conversations. If you need more information about Hospice of Rockingham County, you can call us at 336-427-9022. You can like us, follow us on Facebook, or find our website at www.hospiceofrockinghamcounty.com.